going, but the fact that I had to come back on, I wasn't able to get it. All right, now we're back in slideshow. All right, here we are. All right, so June office hours. Happy summer, everyone. And hope you're all off to a good start, even though it's hot out there. And keep cool, but we'll get to it here. Policy and procedure updates, we've got quality performance updates, some stuff with DataDen, NetSmart, and then a couple miscellaneous things for the month. So we'll start off with our policy and procedure updates. We have a couple this month, and then we have some upcoming policies. Jess, I don't know if you wanted to touch on those that we have for this month.
Sure. Today we will be going over Health Home Plus for HIV/AIDS, and then I will touch briefly on the new policy for high fidelity RAP, referral and enrollment process. Upcoming, we have Children's HCBS. We have Children's HCBS waiver service definitions. I actually sent that out last week in the DOH format. It is 72 pages long. So I will be putting out an AHI policy, but it will take me a minute. So in the interim, please use the DOH policy that was issued. We have an update to our comprehensive assessment, our long-awaited comprehensive assessment update. We got a finalized policy from the state, which now moves the due date to 56 days. That will be reissued. It is under review right now. We'll also be going over continuity of care, palliative care, assignments and referrals, and interpreter services are all forthcoming in the next couple of months. So the first policy we have that was issued, I think it was last month or the month after. I'll pop. There you go. Was our Health Home Plus policy for HIV/AIDS. You can go to the next slide, Travis, slide 4. There were no changes to this policy. It was an annual review. Just a couple things I wanted to point out is that your CMA does have to be specially designated by the AIDS Institute if you are going to serve folks at the Health Home Plus rate for HIV and AIDS. It is a separate designation from the Health Home Plus OMH program. So you do have to be designated for both if you would like to serve this population. These folks would obviously have a primary diagnosis of HIV or AIDS and either be not virally suppressed, be homeless, engage in intravenous drug use with 3+ hospitalizations or 4 ED visits in the last 12 months, or they can have clinical discretion from their MCO or their medical provider. So that is the criteria to serve somebody at this level of service. It works just like the SMI program, where you have to make sure you have documentation and that you're billing at the correct rate that you have documentation for. So nothing has changed per policy. It was an annual review. Just wanted to remind folks that you do have to be specially designated for this through the AIDS Institute and what the qualifying criteria is. And if you have a member who qualifies for Health Home Plus SMI and for Health Home Plus HIV/AIDS, you would serve them under the program that fits their needs best. So if the prevailing issue or concern that they're having is their medical diagnosis, you would serve them under Health Home Plus for HIV. If the prevailing problems that you are seeing and working on fall in the SMI category, you would serve them under the OMH Health Home Plus program. Does anybody have any questions? All right, you can move to the next slide. The next slide is going to discuss our high fidelity wraparound referral and enrollment process. So this is a brand new policy. It will walk you through what to do if you go to do your assessment for high fidelity RAP and they come out eligible. As a reminder, the assessment for high fidelity RAP is embedded in your CANs. So whenever you do a CAMS, if the member meets certain criteria, you will be asked to do the additional screen. It is not optional. So it will walk you through how to determine if someone is high fidelity RAP, how to talk to families about the high fidelity RAP, and then how to make referrals for high fidelity RAP. So that can be done a couple of different ways. There's going to be workflows, all of which, when making a referral for high fidelity RAP, do include contacting the health home. So that's super important that we're not following any type of process, does not have the health home included. That's also, as a reminder, if you were accepting any referrals from SPOA, because SPOA can do the high fidelity RAP eligibility, just like they can do that HCBS eligibility now, you want to make sure that you are including the health home. Currently, high fidelity RAP is only available in Clinton County and Essex County. So if you have a member in one of those counties that comes back high fidelity RAP eligible, even if your CMA does not provide high fidelity RAP, you do need to follow this policy, because we have to do our due diligence to offer the program to the family, explain the program to the family, and then know where to refer the family if they would like to receive services. So right now, if you are in Clinton County or Essex County, you are offering high fidelity RAP if they come out eligible and there is space for them. In other counties, if you do get the eligibility determination, it comes back eligible. Right now, you're not doing anything with it. We're not talking to families about it until we have the expansion of providers. And we are waiting on OMH to give us the new application packet for high fidelity RAP services so we can expand them through our network. Does anybody have any preliminary questions on this? Otherwise, it is very thorough as you walk through the policy, but I didn't want to walk through it since we only have it in 2 counties right now. All righty. If you guys have any questions at any time, you know where to find me.
All right, thank you, Jess. A couple updates on NetSmart. So the CBQ form, that billing issue that we had that went into play from the 4.1 change for that form, that finally got cleared up through NetSmart. Their engineering team got that resolved late last week. So we did start to process our billing through Millen early on in the week, and we started to push through those batches. So we're hoping to get those claims processed in the very near future. It's going through the clearinghouse. That is going to go all the way back to 4/1 of 25 through June up to present. So we're looking forward to getting those claims processed for folks, and we appreciate the patience through this time frame. I know it's been a while getting that resolved. It was an issue that was with NetSmart and their engineering team, and we're glad that they were finally able to get that taken care of. So wanted to make sure that you all had that update. If there's any questions on that, please let us know. Anything that you still had further questioning on, please let us know, and we can definitely follow up on that for you. And then another thing with NetSmart, the comprehensive assessment error, just wanted to remind, this is a carryover from our last office hours. There's still errors with the professional network in the assessment. So please avoid using that professional network in the comp assessment until further notice. That's an open ticket with NetSmart currently still. So we just want to make sure that folks are aware of that and are making a conscious effort not to use that particular area of the assessment until that's resolved. Any questions on those 2 items? Okay, keep on moving. Taylor, do you have anything on this item you want to talk through?
Yeah, I just wanted to bring to folks' attention that there is a new report in DataDen that is available to you guys to help assist with care transitions. I rolled this out, I think, last week or the week before, after we did the care transitions biannual audit on the quality notebooks. This will help you track utilization. So for the supervisors, you will see everybody that is enrolled with your agency. You will see a count on the left-hand side that'll show you the count of ED visits and hospitalizations. On the right-hand side, it'll show you the dates of the visits that the individual visited the hospital or the ED. and it's only going to show you data from the last 12 months. So just another tool to add to your toolbox when you guys are going through your utilization and ensuring that you're doing follow-up with those clients. Thanks, Travis.
Yeah. Thank you, Taylor. All right, next topic, referrals. We had talked about last office hours about the health home transitioning, the referral workflow process a little bit on the front end, starting on 6/1, having CMAs directly entering members into MAP. The process had started as of 6/1. We are working with care management agencies transitioning to that process. There's some organizations still working on that. Getting MAP access, getting set up, reaching out to the health home on some assistance. We're more than happy to work with some of those organizations in doing so, but understanding that the expectation that agencies are moving to that part of the workflow with the understanding that it is a front end access so that you can get folks into the system quicker, so that you can get serving those individuals faster. That's the whole intent of the process, and getting them in, getting them served, getting them part of your organization, getting things moving. So if you have questions, concerns, please reach out. But we want to make sure that people are moving forward as organizations. It's up to the supervisors how you want to implement that within your agency. But we want to make sure that you're moving forward. And we had left the slides in on process. The referral process is in our policy. We have it mapped out for the adults in the policy. We're going to be adding the children's steps, but it is in this slide deck as it was last month in the office hours slide deck for the adults and children on the steps and following through in MAP. For the adults, it's fairly straightforward, 6 steps and getting in to get that individual in the system. And then for the children, it's a little bit more involved as far as steps. But just wanted to remind folks of that expectation from the lead to the care management agencies. Before I go forward, I just wanted to see if there's any questions on that, anything anybody had that they wanted to talk through on it. Okay, please reach out. We're out here for you if you have anything you want to talk through on it. Next thing, we have our audit review tools updated for adult and children's side of the house for each side. We did our audit sample tests for our internal comprehensive chart audits that we use these tools for when we audit for each care management agency, as we do those for your comprehensive chart reviews. Each time we go through our cycle for doing that, we went through and ran these updated tools for the last couple of months as we've done our reviews. We've got them up to snuff based on Department of Health changes and tweaks that we've made for our lead. And we've posted them on our agency website for the health home page for your accessibility as well. I can send them out to the network as well with the slide deck, so that you can have them available via that mechanism as well. But just know that they're up on the webpage for your accessibility in the forms section, so that you can utilize them at any point. Please use them. They're what we use, and that's what we use as we're doing our chart reviews. And they're also the tool that Department of Health uses as standards. We pull our questions from what the DOH uses as their questions when they're auditing the lead. So this is all information that's basically pulling from reg and standards and guidelines from the Department of Health /OMH as they're looking at things. So it's legit. So we recommend highly that you're using that when you're looking at your own stuff internally. And some upcoming trainings that we have. These are specific to children's program. These are DOH trainings actually that are coming forth. There's one on July 14th at 10 a.m. for staff compliance for Department of Health. And there's incident reporting complaints and grievances training on July 28th at 10 a.m. Jessica, did these get sent out? offhand? If not, we can make sure we get them sent out.
Yes, they
If you-
were
I-
sent via DOH listserv, and then I also resent them out to the network.
Okay, I couldn't remember offhand. If not, we could definitely do it again. But just want to make sure everybody's aware that they're there, as an option for folks to attend. And we encourage folks to do that if you're involved with the children's programming. Thanks, Jess. And that's what we had for today. It wasn't a super long presentation or agenda today for us on the lead side. Did anybody have anything they wanted to talk about, share, comment, discuss?
Travis, it's Taylor. I think one of my slides disappeared into the abyss. So I just wanted to touch on one other thing that I had related to the entering of the referrals.
Yes.
So now that you guys are entering your own referrals into MAP, just a couple of things to note from our end, just some housekeeping items that I've noticed. So if you are putting someone directly into an enrolled status in MAP, they are going into an enrolled status into NetSmart, and you will have to manually go in and put in that health home consent for that member through the consents tab. So you guys are probably used to the workflow where you're putting that consent in through your enrollment note, through a client search note. If you're entering them through MAP as enrolled, they're going into NetSmart as enrolled, and you have to remember to put that consent in. It's super important because that's going to pull back over to MAP, and it's also going to help trigger all of the dates in DataDen. If you have any questions on if you have any that are missing a consent, you can access that information through DataDen. Just toggle to your member quick list and you can filter on consents to see if you have any empty dates. And then the last thing is to just be mindful of making sure that you're uploading your referrals onto your members charts when you're putting those members directly into MAP. We don't have the referral coordinator putting those in for you anymore. So just make sure that those are getting put into the chart. Thanks, Travis.
So it's Jackie. I just have a question about the MAP thing. So there's not an option. They have to go in as enrolled. Is that what you're saying?
Nope,
No.
they can go in client search or enrolled, but if you're
Okay.
putting them in as enrolled, you just want to make sure that you're putting in that consent because you
Okay.
won't do it through the note.
I gotcha. Okay, thank you.
You're welcome.
Thank you, Taylor. Any other questions or anything that anybody wanted to talk about? All right. Well, I hope you all have a great rest of your afternoon, and thank you as always for everything that you do every day. And have a good 4th of July weekend that's coming up as well. Take care, everyone.
Thank
Bye,
you.
everybody.
You too.
Thank you.
Thank you.